I really hate this thing in African hospitals that I must come and beg you to do a job. You're gonna need to be friendly with the nursing staff. You need to be friendly with the senior nursing staff, like the matrons. What other things did we see other than diarrhea? And if you want to date at all in the hospital, date one person, and if it doesn't work out, at least you tried. You've just celebrated getting through 6 or so years of stress, turmoil, pain, and your hard work finally paid off. But you were a student for all those years, and now suddenly you're expected to be a capable and competent doctor. You are literally responsible for people's lives. Medical internship can make you or totally break you. It's survival of the fittest. Internship is that period you use to bridge the gap between what you learned in med school, what you don't know, and what you need to know as a doctor. It's such a crucial period as it determines the outcome of your career in medicine. So, where do you do your internship? How do you decide that? What rotations do you start with? What do you need to prepare? What things do you need to know before you start your internship? What do you need to make sure you know before you finish your internship? How do you study during internship? How do you balance studying and working? Your mental health? Navigating all the things you didn't get taught in school but are expected to know? Join me on my YouTube channel as I talk about all things internship related in a series of videos this month. Subscribe to my channel and have your notifications turned on so you don't miss any of the videos. Hey my loves, welcome back to my channel. I'm Natalie Caitlin and welcome back to our medical internship series. This is the third video. If you missed the previous 2 videos, in the first one we talked about how to decide on where to do your internship, what things should you consider, what questions should you ask yourself, and then after that in the next video we spoke about what to prepare and what to do before you start your internship, and all those videos will be linked in the description box in case you missed them, as well as at the end of the video, as well as on the screen right now. And in today's video we're going to be talking about how to go about your internship, like what rotations to start with, how to set up your rotations, how to study during your internship, like how to balance studying and work, you know, what to expect during your internship, like relationships with like your nurses, your assistants, the specialists, senior doctors, people from lab, you know, all those things, how to navigate kind of just like life in the hospital, because as a student you just come and go. But as an intern, you practically live in the hospital, and it's a totally different dynamic, a totally different ball game, and that is what we're discussing today. So do stay tuned, and with that said, let's get right into it. But the first thing, and for me that I think is the most important factor, something that is not always in your hands, something that you don't always have a choice in, is how to go about your rotations. Listen, if you have a choice, start with internal medicine. I kid you not, like internal medicine, starting with internal medicine is the best thing you can do for your internship and for your medical career. Both times that I did my internship, I started with internal medicine and I didn't care what happened after that, but starting with internal medicine was an absolute necessary thing, and I'm so thankful that I did that and I was bold enough to do that, because a lot of people see internal medicine as intimidating, and it really is, because internal medicine is that department where you're going to get shat on, you're going to get insulted, you're going to look like a fool, you're going to study and still not know anything. But internal medicine is like the basic, it's like the heart of medicine. I hate internal medicine. I might sound like I love it, but I really hate it. I hated internal medicine. But internal medicine is like the foundation of medicine. If you do your internal medicine, every other rotation that you do is going to be so much easier. Why? Because internal medicine has a bit of everything. So you're going to learn all the pathophysiology of all the diseases. You're going to learn basic management of a patient, antibiotics, pain management, you know, things of that sort, PPIs, whatever drugs, you name it, you're going to find them in internal medicine. That is going to prepare you for dealing with drugs in pediatrics as well. It's going to prepare you for learning how to do a cannula on an adult. It's going to prepare you for trying to do a cannula on a child. There's no way you're going to be confident to do a cannula on a child if you've never done a cannula on an adult. Am I making sense? If you've already done an anesthetic tap in medicine, doing a bigger procedure like a chest drain and surgery is going to be much easier because you have the confidence, you have put a needle in someone before. So putting a knife or a scissor or forceps in their chest is not going to be so overwhelming. You get my point? So like internal medicine is really like the father and the mother and everything of internal medicine. I talk way too much. But anyway, so how I suggest you go about your rotations is literally internal medicine and then pediatrics and then surgery and then obs and gynae and then emergency medicine, A&E, and everything else that comes that you have to do. When I did my rotations in Botswana, I had to do internal medicine, pediatrics, obstetrics and gynecology, surgery, dermatology, ophthalmology, accident and emergency, rheumatology. There were so many things that were just like, but in other places you really just have the big four, which are IMED, obs and gynae, pediatrics and surgery. So always consider starting with internal medicine. You really like, even once you've like been shattered by internal medicine, it doesn't get any worse than that. So your internship, the rest of it will really be a breeze. There's no point for you to go and enjoy life and then come and suffer at the end, because then you're going to be totally drained and demoralized. But if you suffer at the beginning, by the time you're going through the rest of your internship, it's just like smooth sailing. Internal medicine expect like a lot of questions to do with like pathophysiology, manifestations, things of that sort. Basic procedures will be like cannulations most of the time. Your nurses will call you to tell you that the cannula is blocked, they've tried to flash it 5 times, or the patient removed their cannula. There will be so many cannula stories in the internal medicine rotation, and I don't even understand how. There'll be a lot of deaths as well in internal medicine, especially like, so be prepared for that. In terms of procedures for internal medicine, like I said, a lot of cannulations, ascitic taps, pleural taps, lumbar punctures as well. Those are like the most common procedures that you're going to do in internal medicine. Pediatrics, expect to see a lot of gastroenteritis, diarrhea, a lot of coughing children. You have to know the difference between pneumonia and bronchitis and what. Do you give antibiotics or not? Which antibiotics do you give? You're going to prescribe a lot of Ampiclox in pediatrics. You're going to see a lot of malnutrition if you're in Africa. You're going to see a lot of, what other things did we see other than diarrhea? Tonsillitis, a lot of just like infectious little weird diseases as well. Cannulating babies is going to take a lot of patience from you. And you need to be patient, because if you want to cannulate a baby, if you want to take blood from a baby, you have to be very patient, because you're probably going to have to try like 20 times before you finally get it in. And the parents as well, you need to be able to communicate with the parents, the moms especially, and communicate what you're doing and why. For your surgical rotation, prepare to be assisting in theater for long hours on end. Hopefully the surgical team in your hospital will be nice. Everywhere where I've done surgery, the surgery team was generally like friendly and always joking around, never serious, which was good. It makes it fun to work around. You'll definitely do a lot of suturing. You might do other complicated procedures like chest drains, and we're going to see a lot of MTA patients, people that have been in accidents, drunk drivers and whatever. You're going to do a lot of POPs, a lot of post-op care as well. So that's that. A lot of appendicitis. General surgery for me was just very boring. Was such a drag. But for me in Botswana, but in Tanzania, I quite enjoyed it, and I was working really well with the general surgeons that we had. There'll also be a little physiology here and there, but there'll most commonly be like management of those diseases and what to do, like practical things. You'll have a lot of fighting with the internal medicine team, like pushing, this is your patient, and them sending it back, no, that's your patient, all of that. Be prepared for that, because it's always down to the intern to deal with the mess. Obs and gynae, obviously expect a lot of evacuations if there's miscarriages, a lot of PVs, you can't run away from those, a lot of deliveries, obviously, C-sections. But gynae is fun. Obs and gynae for me was just like really fun. I thoroughly enjoyed it. So how to study? Study as you go. What I mean by that, if you're in the internal medicine rotation, there is no need for you to be studying preeclampsia. You get my point? Like, if you're in internal medicine and you're in the nephrology department, make sure you know everything to do with Aki and CKD. Make sure you know all the nephrotoxic drugs. Study based on what you're in, so that it's easier, because you're seeing these things every day, and going back and doing it at home and then coming to see it in the ward is going to make it stay in here. So what I used to do was I would wake up early at 4. I'm sure you guys remember my 4 a.m. morning routine, which I actually filmed during my internship time in Botswana. I used to wake up at 4, make a cup of coffee and study. I don't drink coffee anymore, but I still wake up early and get some work done before I go to work. Study, get a session in. And how I would study was, if I know that this week I'm in the cardiology section, then I'm studying something from cardiology, because the way your internship is going to be set up, right? Internal medicine, let's say, is 3 months. You're going to have 4 weeks of cardiology, maybe 3 weeks of nephrology, maybe 2 weeks of rheumatic diseases, of rheumatology, maybe 1 week of hematology. So study it like that. Do cardiology while you're in the cardiology ward, because it's going to make things easier for me, because you have those patients as case studies in the ward. You have their medications. You know that you have a hypertensive patient whose hypertension is uncontrolled. You're trying to do everything. He's had all the labetalol that you can take, and you're not doing, and it's still not controlled. You have all the diabetic patients. Do you know the DKA protocol? This is the time to learn it, So that's what I mean when I say learn as you go. Study your patient's files from the time that they came in. How did the patient present? What was done? What were the differential diagnoses? How were they excluded? What investigations were done? What were the results? So when you get this result, it means that treatment must be implemented. Okay, this treatment plan, is it, can you use it all the time for different patients? How do people respond with the DKA protocol? Why is it different from this patient and that patient? Things of that sort. And that will make your life so much easier, because it's really going to be chaotic for you to be trying to study preeclampsia, gastroenteritis, and pediatrics while you're doing cardiology rotation. It's not going to work out. You're going to get yourself burnt out. If you're on call, have your pocketbook there. Read through, like if you have an admission of appendicitis, read appendicitis, the Alvarado score, all of that. Do that, and that is going to make your studying a lot easier. And when you study something that you actually can see, it's going to help you to remember it in the future as well, because now you're actually a doctor. Studying is easier if you're doing case-based studying. So do cases, analysis. I shared a lot of medical apps back then when I was in school on apps that help you like to practice medicine. I think I should probably do an updated video from this. If you guys want to see an updated video on medical apps and books and resources to help you in medicine, let me know. I'll be sure to compile that and do that for you guys. But apps like Prognosis help you with that. You can just study a case, and then it gives you, it's like a game essentially that you're playing. So it makes studying less daunting and less, just like hard to do. Do multiple choice style questions, because if you have a post-internship exam like we did, do questions based on whatever type of question style that they're going to do. So we knew that was going to be multiple choice. So obviously you have to be doing multiple choice questions throughout your internship, right? Okay, in terms of navigating work relationships, like you're going to have a lot of relationships people in the hospital. Like you're going to need to be friendly with the nursing staff. You need to be friendly with the senior nursing staff, like the matrons. You have to be friendly with the attendants, those that are not nurses but they're not, what are they called, attendants. You have to be friendly with those guys, because these people are the people that you want to be on call with all the time. And so if there's something that you need to get done, if they want to sleep, they're going to leave it because, it's you. They're going to do it for you. I know it sounds so silly to say they want to sleep, but because it's you asking, they'll do it, even though it's their job. I really hate this thing in African hospitals that I must come and beg you to do a job. As a nurse, why do I have to come and beg you to please go and give Mr. So-and-so his medicine because it's past its time? As a person who's there in the hospital to do that job, why are you not doing your job? Like, why are you sleeping on the job? I know we're all tired, but guys, people's lives are literally at stake here. And that's the one thing that I really hated during internship, like begging people to do their job. I hate that. As the person at lab, why am I calling you 25 times to get my HB back? Like, why am I calling you 25 times to get the results of a test that I ordered 5 hours ago? Like, why are we doing that, So you're going to have to navigate and find a way of like having good relationships with these people, so that when you ask them to do things, they don't see you as, you're overbearing and you're annoying and they don't want to work with you and they make your life difficult, because people can really make your life difficult in the hospital. And don't be surprised if people do that. Some nurses will hate you for no reason, or maybe they think you've stolen somebody from them, so they start giving you attitude. Yo, guys, hospital life is a lot. It's a lot going. But anyway, so yeah, in terms of like lab, there's got to be patients that need blood, and they have blood in the lab, but they don't want to give you guys because I don't know. So if you're friendly, you know, like, John, you know, hook me up with 2 units. John, if John likes you, he'll give you 2 units, and you might even reserve an extra one for later for you, you know, type of thing. So you need to know who to go to. You know, you need to have a go-to guy at the lab, a go-to guy at radiology, a go-to guy like in each and every department of the hospital to make your life and especially your calls easier. Because during the day, if someone refuses to do something, I'll just go and report to the specialist and be like, they said they don't have, and you will call them directly and, you know, get it sorted. But on call, you're on your own, child. No one is going to come and fight for you. So there's that. It's also important to have good relationships with like your interns, like your fellow interns, because there's going to come a time when you're on call and you don't want to do that call and someone has to cover you. And if you're being rude and nasty to everyone, no one is going to take your call for you. No one is going to want to help you. No one is going to help you with your weekend shift. And just generally, guys, be kind and respectful to everyone, regardless of their level. Treat the specialist, the super specialist, the same way you treat the cleaners. Greet everyone. Be nice. You don't lose anything from being nice to people, right? Yeah. And so just like other things, always be on time. Do your part. You're part of a team. Don't let the team down. Show that you're willing to learn, and this will take you further, because people, like those that have the knowledge, when they see that you're interested in learning, specialists love sharing knowledge. They like to show that they know what they're doing, you know. And how best can they do that other than by teaching you? So if you show that you're in a position to learn and you want to learn, they will teach you. They will give you free knowledge. Yo, Batong, don't date everyone. Like, don't date. Today you're dating this one from lab, tomorrow you're dating that from radiology. Don't be that person. If you want to date at all in the hospital, date one person, and if it doesn't work out, at least you tried. And then mind your own business. You guys know me. You guys know on TheStylishMed, we mind our own business. We don't dwell in things that don't concern us. We focus on what we came for. We remember what we came for, and that is what we do. And so my very last point is remember what you came for, because internship is going to be hard. There's a lot of things that are going to happen, things that you don't understand. It's a new dynamic. From being in school to being in the hospital is like a totally different shift. And so there's going to be a lot that you need to get adapted to. Don't let the new title get to your head. Essentially, stay grounded, stay humble, otherwise life will humble you, and you don't want life to humble you, so you better humble yourself. And in conclusion, don't be too hard on yourself. Like, these things, you'll learn them eventually. Like, you'll just wake up one day and realize, I know what I'm doing, you know. You'll get there eventually. It's okay to be scared in the beginning. It's okay to be nervous to do procedures. It's okay, but work on it. Don't be comfortable in your lack of knowledge. Don't be comfortable in your iniquities, so to say. No one expects you to know everything as an intern, and that's why you're there. You're there to learn. You're like the bottom barrel of life in the hospital. You're expected to be like the scapegoat of everything, so don't take everything to heart. If you get shouted at, if you get scolded, it's okay. Wake up tomorrow and come back the next day. Actually, the last video of this series is going to be touching on mental health and how to navigate it all and how to just like stay sane during internship. So do stay tuned to the end of the series. I'm sure you guys will appreciate that video. And so that is all I had to say in this video. If you missed the last videos where I told you guys how to decide where to do your internship, what to prepare, do watch them. The link will be in the description box below, and as well as at the end of the video. In the next video, I'll be telling you guys all the things that you need to make sure you know before you finish your internship, and things that you need to do before you finish your internship. So do stay tuned for that. Otherwise, thank you so much for watching. Leave a like, leave a comment, let me know what you want to see from me as well. Subscribe to my channel if you haven't already, and I will see you guys in the next one. Love you guys.